It's recording disease pathology.
Hey Jim, so what disease did you get this semester?
I managed to draw Sjogren's, which is an autoimmune disease which attacks the saliva and tear ducts in my face, but has the potential to progress as it worsens.
Wow. How would you get tested for it if you were worried if you had it?
Testing, there are several ways, which include biopsy of the salivary glands, but the main two ways are in ANA, which is an anti-nuclear antibody, which is a blood test, or rheumatoid factor, which both can determine the presence of basically, how would I say, I guess kind of like keystone or like red flags that would indicate an autoimmune process, and from there they can further narrow it down.
So how is it progressing?
As it progressing, well, it's currently attacking my tear ducts and saliva glands, which is causing dry eyes, sore throat, dry mouth, cracking, mucous membranes, and bleeding, which is not good. It sucks.
Yeah.
It really, really sucks.
How's that affecting your lifestyle changes? I mean, that's gotta be pretty big.
Oh yeah. Having taken all these different medications, it's like cyclosporin basically is an eye drop I have to take, specialized prescription eye drop I have to take every day and to keep my eyes moist. I have to take these two different medications that produce saliva, which are Vactocin and Salicin, yeah, whatever, I can't pronounce it, but I have to take them to help produce saliva, and I also have to change up my diet, which basically I have to give up hot food, and also hot meals, so more of softer and that kind of muscular food, and like lukewarm, cool food, and yeah, it sucks.
Yeah.
And the best part, yeah.
Yeah. So I know that you developed RSV with it, and I know that usually happens in younger infants. How does that happen relate to your disease where you have it older?
Well, usually RSV, which is respiratory syncytial virus, only happens in kids, but as my autoimmune disease progressed, I managed to get lupus, which helped attack my lungs and attacked other organs, which include joint pain and inflammation. But back to the lungs. With the suppressed immune system and issues with my lungs, well, a normal person wouldn't be susceptible to an RSV, and I was. And as RSV worsened, it progressed into bronchiolitis, which is basically, bronchiolitis is the inflammation of the smallest areas in the lungs.
Wow.
Which is not altogether good.
No. Wow.
Yep, and as a result of lupus and bronchiolitis, I'm taking extra strength painkillers and also warfarin gel, which helps with the joint pain and inflammation. And got diagnosed the bronchiolitis and RSV with a nasal swab and chest x-ray. And I was admitted to the hospital after the whole bronchiolitis and RSV thing, but hey, nothing big. It's only the hospital. Yeah, so while I'm here, they gave me a nasal cannula because my oxygen saturation was low. And also giving me bronchodilators to open up my lungs, along with a inspiratory spirometry to prevent atelectasis. And in case my bronchiolitis worsens, they plan on giving me ribavirin, which is some heavy-duty thing. And potentially antibiotics if I develop pneumonia. And other than being under observation only for everything, yep, that's pretty much it. Alone, there's just a support network, just me and whoever wanders in my room.
Oh, that's awful.
Yep, it sucks. Yeah, I'm kind of depressed about it, but hey, what about you? How's your disease going?
Well, I got COPD, which is chronic obstructive pulmonary disorder, disease. It's basically a group of diseases like emphysema and chronic bronchitis. Makes it hard to breathe, and it's usually caused from many years of smoking or being around chemicals. It's not good. It only gets worse. It doesn't really get better. It doesn't go away. They don't have a cure for it, but, you know.
Sucks.
Yeah.
So, how are you, diagnosed with it? How do they test for it?
Well, there's a couple of different things you can do. If you're worried about it, you go to your doctor and ask them to give you a spirometer test. I think they do that 3 times, and they measure your FEV. It's your forced expiratory volume, and that helps them tell how much you're breathing out and how much is coming out of your lungs. Or you can get an ABG, which is a blood test that they take blood from your artery to measure your oxygen saturation.
That must hurt.
Yeah, it's painful. I would go to the spirometer test personally.
Okay, so how's this really affected lifestyle changes, how you get around, do stuff?
Well, definitely makes it harder to climb up the stairs to class. Well, I had to quit smoking first and foremost, which was awful. And that was the main cause, so I stopped that immediately. My doctor suggested a diet change to make me healthier and make my heart as strong as it can be, so that way I could fight this. I'm on a lot of medications. I've got a whole list. I've got nebulizer. I have to take a treatment of albuterol every 4 to 6 hours, which sometimes makes me kind of shaky. I have a rescue inhaler with albuterol in it, and that's only for emergencies, thank goodness. I'm on 2-Dorza, which is a dry powder inhaler. I take that twice a day, and it helps me maintain open airways. And I'm also doing a PEP therapy, which when I breathe into it, it helps move the secretions in my lungs, so I can cough it up better and get it out of my lungs. And yeah, there's a lot. It's a big thing. It's a lot to deal with.